Endoscopic or keyhole procedures are now well established in all subspecialties of surgery. Be it a laparoscopic cholecystectomy, hysterectomy, or a third ventriculostomy, or even an endoscopic dacrocystorhinostomy. Endoscopy can be very useful in ocular diseases also, both as diagnostic as well as a management tool. Here in this video, the diagnostic angle will be stressed upon. Visualization of the ciliary body is direct, and its appearance in various etiology of glaucoma is very distinct. In open-angle glaucoma, it is well spaced and the processes are not very large. In contrast, in angle closure disease, it is very crowded and rather bulky in nature. This is even more marked in plateau iris syndrome. In spherophakia, it has a very peculiar shark fin-like appearance. In pseudoexfoliation, one can see the deposits not only on the ciliary body but also on the zonules. And herein lies one of the great advantages of the endoscope. During the process of delivery of laser, none of the zonules appear to snap. Further, the endoscope can be inserted into the anterior chamber to visualize the angle before and after laser. In some cases of angle closure, the angle seems to open up post-laser, albeit with heavy pigmentation. In a case of uncontrolled IOP on max medications, status post failed trap, tube and cyclocryo, decision to laser the ciliary body could be taken only after direct view revealed that the processes were not atrophied. This one-eyed gentleman now enjoys controlled IOP on 2 medications. By far the most important function of the endoscope is its use in prognostication in corneal opacity that precludes view of the posterior segment. This is possible only by visualizing the posterior pole and the disc endoscopically. In adults with corneal opacity, for example in alkali burns, a visually evoked potential is an alternative. However, the availability of VEP under general anesthesia for the pediatric age group is limited. Therefore, the endoscope comes in very handy. In one such case of corneal opacity in a child, the right disc appeared normal, but not the left one. So further surgery was considered in the right eye only for optimum utilization of scarce financial resources. In yet another case of corneal opacity in a child, the posterior pole did not look normal at all, with very atrophied or absent choroid along with a very anomalous disc. This endoscopic view of the posterior pole exposed the limitations of a B-scan, which was reported to be within normal limits. Management of IOP with photocoagulation is now very well established, but an endoscope can also be used to perform pars plana vitrectomy in the presence of corneal opacity. In similar situations of corneal opacity, in children, an endoscopy-guided goniotomy may also be performed. Thus, this one probe has multiple invaluable functions and has a multitude of scope in the diagnosis and management of ophthalmic diseases.